South of the border, an unprecedented outbreak of bird flu in dairy cattle keeps growing. More than 30 herds across 9 U.S. states now have confirmed infections, and scientists warn the outbreak is even bigger than it appears. Government tests on processed milk found virus fragments in 1 out of every 5 samples.
The fact that we're finding viral RNA in pasteurized milk doesn't mean that there's virus in the pasteurized milk that's going to make people sick, but it does mean that there was an infected cow contributing to the milk supply.
Officials say there are no reports of this virus in Canadian dairy cattle, but there have been millions of infections among wild and farmed birds across the country, suggesting there's plenty of H5N1 circulating here, too. CBC News asked federal officials what process is in place to detect any traces of the virus in Canadian milk. The Canadian Food Inspection Agency says that's not happening yet. They'll help with testing should H5N1 be detected in Canadian cattle. The agency is also requiring dairy cows imported from the U.S. to be screened for bird flu.
I think we're way behind the virus.
Scientists say Canada needs to be more proactive.
In the absence of a robust national surveillance program, there's no way to know if there is infections here or not.
At the University of Guelph, researchers are taking matters into their own hands. The team started tracking influenza in Ontario wastewater a few months ago to study trends in human infections. Now they're pivoting to see if any H5N1 shows up.
We're seeing very low levels, if any, of influenza right now. So if we should see a sudden spike, then that would certainly get our attention.
The hope is by tracking the virus early, there's a chance Canada could prevent an explosion of cases striking our dairy cattle as well. Lauren Pelly, CBC News, Toronto.